Welcome to the Living Donor Kidney Transplant Education session. I am Dr. Amanda Leonberg-Yu, the Medical Director of the Penn Living Donor Nephrology Program at the Penn Transplant Institute. I'll be joined today by Dr. Robert Redfield, the Surgical Director of the Living Donor Kidney Transplant Program, and by Mary Kate Wilhelm, a PA within the Living Donor Kidney Transplant Program. We encourage you to take notes regarding any questions that may arise during the presentation so that you can review them with your Living Donor Coordinator. Before we get started, I'd like to take a moment to recognize your inspiring altruism and generosity in considering being evaluated as a kidney donor. It is our hope that this information will assist you in making a well-informed decision about living donor kidney transplantation. The purpose of this video is to review all aspects of living kidney donation. Together, we will be covering information about the kidney donor process. This video is structured in 4 parts. The first part provides an overview of living donation in the United States, including your rights and responsibilities as an individual, confidentiality associated with the process, alternatives for donors and recipients, and an overview of our multidisciplinary team. Part 2 includes the donor process, from referral to evaluation and selection to the surgery itself. This portion of the video reviews the short-term and the long-term outcomes of living kidney donation for donors and recipients. Part number 3 focuses on post-surgical care that is necessary to keep you healthy in the long term. Finally, the last part you'll hear about includes resources and support for individuals like yourself going through a living kidney donor evaluation. Living kidney donation is an option for those individuals in need of kidney replacement therapy. Living donor transplantation offers many advantages for people with kidney disease needing kidney replacement therapy. On average, a kidney from a living donor works better and lasts longer. Additional advantages include improved long-term outcomes, faster recovery time. Receiving a kidney from a living donor results in a shorter hospital stay for the recipient. There's also little or no wait time for an organ offer. Organ allocation regulations are changing, and the wait time for a deceased donor organ offer could be more challenging in the future. The process of finding a kidney donor can be challenging for recipients. Individuals are asked to advocate for themselves to identify a living kidney donor, and those in need of a kidney transplant can talk with their transplant team about how to get started. As a potential kidney donor, you have several rights. The first right of a kidney donor is an option to opt out at any time during this process, and for any reason up until general anesthesia is administered. Your health information is secure and is separate from the recipient's record. Only the necessary information is shared with your recipient's team. Similarly, the recipient's health information and risks are also confidential and protected under privacy laws. All communication is strictly confidential. Your potential recipient team may be informed that there is a donor in evaluation, that a donor has been approved, or if there are no potential living donors to consider. You, as the individual, are able to share as much or as little information with your recipient as you like. It is a federal crime to sell or purchase human organs. You can also not receive anything of valuable consideration in exchange for kidney donation, including monetary value. Although rare, donation could have an impact on obtaining health, life, or disability insurance in your future. We do review these impacts with you during your individual evaluation. It is not okay to be coerced into donating a kidney. If you feel any pressure in donating, please notify the donor team immediately. And finally, this presentation is necessary for you to be able to make an informed consent regarding potential kidney donation. Now, there are other alternatives for kidney replacement therapy for individuals living with end-stage kidney disease. We first would like you to know that as a potential donor, you always have the option to change your mind up until the point of general anesthesia. This is a voluntary act on your part. Recipients also have other options for kidney replacement therapy, including dialysis, a deceased donor transplant, listing at multiple transplant centers, or exploration of alternative living donor options. Now, as a potential living donor, you will meet your living donor team during the evaluation process. You will notice that the center of the team is you. You will first talk with an independent living donor advocate, who is a specialized social worker who works with the living donor team in consultation with us. We will review the roles of the ILDA shortly. You've already interacted with a living donor coordinator, and you'll meet each member of the team along the evaluation process, including the donor surgeon, kidney specialist like myself, an advanced practice provider, a financial coordinator, a pharmacist who reviews your current medicines. You may be asked to see a psychiatrist during some part of your evaluation at the discretion of the donor team. You also may be asked to meet with a dietitian as part of an understanding of your overall health and health care. You will also meet with a different type of social worker who sits apart from the independent donor advocate who helps evaluate the social determinants of your health. As I mentioned, the Independent Living Donor Advocate, abbreviated ILDA, is a specialized type of social worker that works with you and collaborates with the rest of your living donor team. All transplant centers in the United States are required to provide an ILDA or ILDA team for all potential donors, and this ILDA works independently but collaboratively with us. It is important to know that the living organ donation is completely voluntary, and the role of the ILDA is to protect the health and safety and assure this health and safety. The sole job of the ILDA is to protect and promote the interests of you as the donor and support you through the entire process. The ILDA assists you in obtaining and educating and understanding the relevant information necessary to provide an informed consent for living donation. They will review with you the consent process, the evaluation process, the surgical procedure, medical and psychosocial risks, including financial risks, and the importance of and commitment to post-donation follow-up. The ILDA must respect the donor's decision and ensure the decision to become a donor is informed, free from pressure by the recipient, any friends or family, and without financial compensation. The next person you have already met is a living donor nurse coordinator. Our living donor coordinators are your point of communication with the living donor team, and their role is to protect, escalate, facilitate, and act as a clinical resource to the living donor. The living donor nurse coordinator screens initial inquiries, escalates and communicates information to our team. They facilitate the evaluation process. They educate you and your family in all phases of care, and they help you prepare for surgery. The nurse coordinator also coordinates progression of the case within the recipient team as well, so they're the point of contact for your recipient team. They act as a clinical resource to you and your family members, and they facilitate care post-donation. Other members of the living donor team are listed here. During the evaluation phase, you will meet with a living donor surgeon, a medical kidney specialist known as a nephrologist, and an advanced practice provider. We abbreviate this APP. We work together to review your individual risks for kidney donation. We will set expectations for the evaluation, surgery, and the postoperative period. We will talk about the short-term and the long-term risks related to living kidney donation, and we will determine whether you need any individualized testing or see other specialists. An advanced practice provider, an APP, also helps to coordinate your care, and they will be involved in your evaluation process and communicates with the rest of the donor team. A social worker, different from the independent living donor advocate, reviews your financial and social support, provides information on donor assistance programs, and assesses psychosocial issues related to donation. A psychiatrist who works exclusively with the living donor team assesses your mental health history and coping mechanisms to ensure that this is not only physically appropriate, but also emotionally appropriate for your level of health. We also have a dietitian on our team who assesses whether your weight is healthy for surgery and whether you need to make any changes for the short term or the long term in terms of healthy habits. We work with a pharmacist who reviews your medications. They may discuss with you some medications we recommend discontinuing before surgery. And finally, we work with a financial coordinator who works to prevent charges associated with living donation from being billed to the donor. This evaluation process is covered under the recipient's healthcare insurance, and the living donor should not incur any out-of-pocket expenses related to the evaluation process. Now, a little bit about your kidneys. So you have two kidneys located in the middle part of your back on the right and left part of your spine. You see the picture depicted here. They're a little bit closer to your lungs than you actually expect them to be. And they're behind your intestines and behind the majority of the abdominal organs. The act of kidney donation means that one kidney is removed. Now, you only need one kidney to live, so one can be safely donated to someone with kidney failure. The other kidney remains in place. That remaining kidney does grow slightly in size. The function grows a little bit more, and it can maintain the level of balance that the kidneys are responsible for. The role of the kidney is really important in the body. It's responsible for making urine. The urine essentially is filtration of toxins and waste that is eliminated from your body, with the ultimate goal to maintain a balance of electrolytes and fluids within the body. The kidneys also help control blood pressure, they help control red blood cell production, and they overall keep you healthy. One of the roles of the evaluation process is to ensure that with one kidney, your health would not be compromised. This concludes the first part of our educational session. Next, I would like to introduce Dr. Robert Redfield, who is the surgical director of our Living Kidney Donor Program. He will be reviewing the donor evaluation process.
Hi, my name is Dr. Redfield. I'm the surgical director of the Living Donor Kidney Program, and I'm here to talk more about the donation process. The donation process is made up of many steps. First is the screening of referral, education, informed consent, referral, screening, the medical and surgical psychological evaluation, donor selection and approval, preparing for surgery and scheduling the preoperative visit, the day of surgery and post-surgery hospital recovery, and then ultimately the post-discharge care. With screening, you have to be in very good physical and mental health. You need to meet certain age requirements. You need to have a body mass index that's less than 35, have health insurance, and you may request a copy of our donor or recipient selection criteria by contacting your coordinator, which will be more in depth. But in general, kidney living donors are between 18 and 70 years old. Slightly older candidates may be considered on a case-by-case basis. Altruistic donors need to be at least 21 years old to be considered, and it's required to have a primary care doctor prior to donation. The evaluation phase can take a minimum of 4 to 6 weeks to complete, and it continues until the time of donation. It's made up of an assessment by an independent living donor advocate, or ILDA, consists of a thorough medical evaluation, surgical evaluation, psychosocial evaluation with social work and psychiatry if needed, diagnostic and lab testing, all age-appropriate cancer screening, including mammogram, pap smear, and colonoscopy, if applicable, and consultation with other living donor team members and specialists if indicated, such as cardiology, infectious disease, hematology, and pulmonary. It is possible that some of the tests or consults may need to be repeated to ensure continued suitability for donation. Donor evaluation and the risks. During the evaluation process, because of the tests that need to be performed, including a CT scan that requires contrast agents, there could be an allergic reaction to the contrast agent. Because of the medical evaluation, we may discover reportable infections. We may discover serious medical conditions that would prevent your donation and require follow-up with your regular doctor. Discovery of previous unknown or adverse genetic findings or other abnormalities. And long-term medical implications of organ donation have not been fully identified. There are potential risks that are specific to kidney donor surgery, and we will discuss these in more detail during the evaluation. Donor selection and approval. So at each point in the evaluation process, your results will be made available to you. The multidisciplinary committee's decision will be shared with you. You may be declined even after completing all the testing. It is possible that you are approved and do not donate for reasons concerning the recipient, changes in health status, potential poor outcome, etc. If you are approved, you have time to reflect on your decision before the recipient is notified, and your decision will always remain confidential. Donor approval for paired kidney exchange. For kidney donation, if you're not compatible with your recipient, there's another option to get your recipient a live donor kidney transplant through what we call paired kidney exchange. It may be recommended by the recipient team to consider a compatible paired exchange to provide a better size, age, or match for better recipient outcomes. Compatible paired donation is also an opportunity to maximize the donor's gift by helping more than one recipient get transplanted. Here at Penn, we participate in paired kidney exchange with the National Kidney Registry. There are many benefits of paired kidney exchange. First and foremost, it can avoid a lengthy 5 to 8 year waiting period on the deceased donor list. The recipient can get a kidney that is a better match, which means it could last longer. It allows the transplant to occur before the recipient may need dialysis. And research shows that the less time a person is on dialysis, the longer a transplanted kidney will likely function. And then surgery can be timed for the optimal health of the recipient and donor for convenience. Through paired kidney exchange to the National Kidney Registry, there's a voucher program, and it allows living kidney donors to choose the most convenient time frame for their kidney donation, regardless of when their recipient needs a transplant. So some examples for considering the voucher program or the ADP, the Advanced Donation Program, include to avoid donor and recipients recovering from surgery at the same time. So if it's a wife donating, to a husband, they can recover at different time points and take care of each other. The donor may need a specific time frame for surgery and recovery due to work-life commitments, say time off over a winter break or so. The donor is ready to donate, but the recipient may not be transplanted yet. So, it may be a year or two until the recipient actually needs a transplant, but the donor would like to proceed with donation and get it out of the way. The donor doesn't have a specific recipient, but wants to help others in need, while also looking out for their family's potential future kidney transplant needs. And that would be a patient who is a non-directed donor and donates into the registry and is able to identify 5 family members that if they were to need a kidney transplant, the first one that would need one would be able to get a family voucher and be able to get a living donor kidney transplant in return. Your living donor coordinator is available to provide further information regarding the Advanced Donor Program and the voucher program through the National Kidney Registry. So preparing for surgery, the date of surgery will be identified that is suitable for the donor, the recipient, and the transplant team. Special circumstances do exist for distance donors and international donors, requiring them to stay at our local center or at some commutable distance for a period of time after surgery, and we will discuss that in more detail if that applies. As far as the preoperative visit, there's really no special diet that's necessary to prepare for surgery. We encourage you to make healthy food choices and maintain or continue to lose weight if indicated. We also recommend not taking any dietary supplements 1 to 2 weeks prior to surgery. Pre-op appointment is scheduled typically 1 to 2 weeks prior to surgery. It is about a 3 to 4 hour appointment. It's an appointment where labs are drawn. We go over the surgical consents and review pre-procedural information and review with other team members as indicated, like pharmacy, inpatient nursing staff, and research. On the day of surgery, you'll arrive at the hospital of the University of Pennsylvania very early on the morning of surgery. General anesthesia will be administered. You will be sedated for approximately 4 hours, and the anesthesiologist will explain the risks the morning of surgery. Monitoring and assistive devices will be placed, such as a breathing tube, a Foley catheter in your bladder to monitor your urine output, as well as external monitoring sensors. If at any point the surgical team believes you're at significant risk of complications or death, the surgery will be stopped. You can elect to change your mind at any moment up until you are sedated under general anesthesia. What to expect during donation surgery? The donation operation will involve removing one of your healthy kidneys, called a nephrectomy, for transplant into a recipient. The surgical team will discuss which kidney will be removed. Typically, it's the left, but we can do the right as well. The surgeon will discuss the incision when you meet with them. What's pictured here is a very typical surgical setup as far as incisions go. The majority of the surgery is done laparoscopically or robotically. You'll have a few tiny incisions, about 5 to 10 millimeters or less than ½ inch. A camera and surgical instruments will be inserted through the incisions. The kidney will be removed through a small incision at the pant line. The left or the right kidney, as I said, can be used for donation, but usually the left will be removed. We do use absorbable sutures and typically do not use staples. Healing takes about 2 to 3 weeks. There will be some discomfort after surgery, but we'll work hard to keep you as comfortable as possible. In rare circumstances, blood transfusion may be needed during or after the donation surgery. So after surgery, after waking, the donor is taken to the post-anesthesia recovery unit called the PACU for observation. The patient will remain there for about an hour or so until everything looks stable and the anesthetics have washed out. They'll be transferred to the abdominal transplant floor where they will go to their room. Usually the hospital stay is about a day or two for donors. And again, the recovery period is about 2 to 3 weeks. Most donors return to their usual activities within 2 to 3 weeks with some restrictions on lifting. They usually return to their most demanding activities within 3 months. The hospital stay and going home. So the post-op goals are going to be early ambulation and getting out of bed. Deep breathing to open the lungs back up after being asleep under general anesthesia. Pain management and getting your diet advanced. Initially, you'll start off with liquids and making sure that you can tolerate, regular food prior to discharge. The donor is discharged when you're able to eat or drink. The discomfort is managed appropriately, typically with oral pain medication, and you're able to manage self-care and walk without assistance. The donor will be discharged with oral narcotic pain medication and stool softeners. To discuss post-discharge care, we'll have Mary Kate Wilhelm, one of our advanced practice providers, go into the post-discharge care in more detail.
Thanks, Dr. Redfield. We will now review our care and expectations for once you return home from the hospital. Post-discharge precautions and restrictions. It is important that you follow these restrictions after surgery. Following activity restrictions help prevent hernia and injury. You are not permitted to lift more than 10 pounds for the first 6 to 8 weeks, which is roughly the weight of a gallon of milk. There's no driving for the first 2 weeks and until you are off all of your narcotics. Walking is extremely beneficial for your recovery. All strenuous activity, though, should be avoided until you meet with the surgical team. It's okay to walk up and down stairs, inside and outside your home, as long as you feel well enough to do so. For care of your incision, you should not immerse yourself in water until your incisions are healed. This means no swimming or taking a bath. You will be allowed to shower. We will discuss your restrictions in more detail at your follow-up clinic visit. Many donors are anxious to return to work, but it is crucial that you take the time needed to allow your body to heal after surgery. Most of our donors return to work 3 to 6 weeks after donation, but in some instances, donors require a full 3 months to recover. Although rare, it is possible that you may not return to your pre-donation lifestyle. You may experience body image changes, guilt, anxiety, or depression. If you feel you are becoming depressed or chronically anxious, please get help and talk to your healthcare provider. Many donors find it helpful to speak with friends, family, and other donors during this time. We will follow you for the first 2 years after surgery. Below, you can see an outline of the required follow-up after donation. This is important for your overall health, as well as the health of your remaining kidney. You will meet with your surgical team 3 weeks after surgery for an in-person clinic visit. At this visit, we will assess your progress, review your activity restrictions, and answer any questions that you might have. 6 months after surgery, you will be seen by our nephrology team. This is typically done by telemedicine, but in some instances, we may request to see you in person. At the 1 year and 2 year anniversaries, we recommend that you continue your routine follow-up with your primary care doctor. If needed, we may request to see you for telemedicine or an in-person visit as well. At each of these time points, we will meet with you to get updates on your health as well as review your recent lab work. All follow-up kidney labs will be reviewed by our team for the first 2 years after donation. Thereafter, you will continue to have your regular annual follow-up with your primary care doctor or a local nephrologist. As you learned earlier, kidney donor surgery is minimally invasive and has a low rate of complications, but this is still a surgery, and all surgeries carry potential risks. I'm going to take the next few moments to review the risks related to kidney donation. There are medical risks that we have categorized as mild, moderate, and major. There are also potential mental health and financial risks. Minor risks require little or no treatment and include an infection at your wound or IV site, urinary tract infection, pneumonia, or an increase in blood pressure. Moderate risks are risks that require a procedure to treat the donor, and these include blood clot, bleeding, decrease in kidney function, hernia, pain or numbness at the surgical site, discomfort with stretching or moving, bowel obstruction, and urinary retention. Major life-threatening risks include a collapsed lung, death, kidney failure requiring dialysis, and complications related to future pregnancies. The mental health risks include new or increased anxiety requiring dependence on others, generalized anxiety, feelings of guilt or sadness, post-traumatic stress disorder, and depression. Financial risks include future health problems related to donation that might not be covered by your insurance. There is a possibility that you may be denied medical insurance, disability benefits, or even life insurance. There are some medical conditions that, if they develop after donation, must be reported to the transplant center, as they may affect the health of the recipient. Examples include any infectious disease or cancer discovered in the first 2 years after donation. If one of these conditions occurs, we are required to notify certain organizations. The following may be notified: the kidney recipient, local, state, or federal public health authorities, as this is required by law, the recipient transplant center, and a national donor database, the OPTN, Improving Safety Portal. If your primary doctor suspects that a health issue is related to donation, please notify your living donor coordinator as soon as possible. Our living donor team will coordinate your evaluation here at Penn Transplant Institute. The recipient's insurance typically covers your medical expenses, but some insurance carriers have special requirements to cover living donors as part of the recipient insurance. While our goal is to minimize any expenses, there may be expenses to you. Financial responsibilities associated with living donation, including post-donation expenses, may not be covered by insurance. Unfortunately, insurance does not cover expenses related to travel or lost wages, but you may be eligible for financial support. There are 2 different programs that offer support for things such as lost wages, travel costs, or dependent care. The National Living Donor Assistance Center, or NALDAC, is available to all of our kidney donors. The National Kidney Registry's Donor Shield program is available to patients that donate through the National Kidney Registry. Please discuss your interest in these programs when you meet with our social worker. The social worker will be available to answer any additional questions that you may have and assist you with this process. If you donate through the National Kidney Registry or Paired Kidney Exchange program, you may be eligible for their Donor Shield program. The benefits of this program include lost wage reimbursement for up to 6 weeks to total $6,000, travel support up to $3,000, term life insurance for 1 year, additional protection in the event you develop a complication, legal support to assist with life insurance discrimination or unlawful employment termination. In the unlikely event that you would need a transplant, the National Kidney Registry, or NKR, prioritize you to receive a living donor kidney transplant, whereas donors that donate directly to their recipients are prioritized to receive a deceased donor transplant. You may receive disability insurance if needed for up to $1,500 for 52 weeks, and they also offer cryopreservation, which minimizes donor blood draws. Outcome data for both national and center-specific outcomes is available for your review through the Scientific Registry for Transplant Recipients, or SRTR. There are no national or center-specific outcomes for living donors calculated by the SRTR, but we encourage you to review the data so you can be aware of the national results as well as Penn's recipient outcomes. Our team is available to you, as always, to discuss donor and recipient outcomes here at Penn Transplant Institute. Please contact your coordinator directly with any questions. Transplant team availability. Our team is available to you 24 hours a day, 7 days per week, and 365 days per year. Our team includes a surgeon, physician, transplant nurse coordinator, and advanced practice providers. We receive organ offers, recover donor organs, perform the transplant surgeries, and address urgent clinical needs for all of our patients. You will be notified within 7 to 10 business days if there is a change in our ability to provide this coverage. In the event of a local or regional emergency that impacts our ability to provide transplant care, we will use available resources to notify you and identify a local or regional center to help transfer your care. There are multiple regulatory bodies involved in kidney donation and transplantation. The United Network for Organ Sharing, or UNOS, is the federal agency that oversees organ donation and transplant. UNOS keeps the national patient waiting list for organ transplants. If you have a question or would like to follow a grievance, you should contact Penn Transplant Institute Administration or UNOS directly. The Scientific Registry of Transplant Recipients, or SRTR, publishes public, national, and transplant center recipient outcome data. Data is used to compare transplant center outcomes. Lastly, we have the Center for Medicare Services, or CMS. Penn Transplant Institute has met all requirements by CMS. We will notify you if our CMS or Medicare status changes. If you have any further questions about these regulatory requirements, please contact your transplant coordinator. This concludes our education session today. On behalf of the Living Donor Kidney Transplant team, we thank you for your time and attention.